For a deeper look at the state of Kenya's health sector and the status of Kenya's fight against COVID-19, I am joined by Dr. Simon Kingondu, who is the Secretary General of the Kenya Medical Association. Dr. Thank you for making time.
You're welcome.
Let's begin by just putting things into perspective. From a doctor's point of view, what would you say is the current state of COVID-19 in the country? How are hospitals looking like, hospital bed occupation, and even ICU beds?
Thank you very much. Since the beginning of COVID back in March, Kenya did very well to put in some measures to try to control it. And we did it. But since the economy, so to speak, needed to be opened up, then we are now getting a rise in the number of cases. The virus has moved to the counties. And if there's anything called a second wave, that is the second wave, the virus moving to the counties. Initially, it was limited to the major cities of Nairobi, Mombasa, and not so much Kisumu and Nakuru, but with the opening up of the economy, now effectively moved to the counties. In the counties, this is where the elderly live, and this is where the so-called vulnerable population is. And this is where we cross our fingers, because we would expect now what we feared, probably an increase in the number of people who get infected, who get severely ill, become evident. And we could have a rise in mortality.
I want to find out, where do you think the fault line or the weak links are? Is it that we are an indisciplined lot, or we reopen too soon, or the government has not taken swift action to contain the disease?
I think when we closed up, there were certain things that were supposed to be done. And this is at all levels. So at the level of the counties, for instance, they were supposed to create 300 capacities in the counties.
Dr. Simon, are you still with me?
You're not hearing?
Okay, go ahead.
Yeah, I'm saying the measures are at all levels. For instance, at hospital and county levels, when we closed up, there were things we were supposed to put in place that were supposed to mitigate the effects of COVID, because we know that COVID will be here for a long time. For instance, schools were supposed to create spaces to ensure that when people come back, then there are COVID measures in place, as advised by the Ministry of Health. Now, counties were supposed to put measures in place. The 300-bed capacities in the counties was not realized, for instance, despite the funding and the time that we had. This is overstretching the few facilities that we are having. Equipping the counties with oxygen didn't happen, and now they are constantly referring even severe cases for supplementation of oxygen elsewhere. And this is supposed to be basic within the counties. Worse still, and your second story has said it, human resources for health was not improved for COVID-19. Very few counties recruited more healthcare workers to prepare for COVID, and they just relied on the few who are under the UHC program, who are just a drop in the ocean for our necessities. Okay. Even you and me, we have seen you attending political rallies without wearing masks, without maintaining social distance, and therefore all of us are responsible for what may be happening.
Okay. With all the factors that you've mentioned, particularly on the health front, and bearing in mind that we could be facing a second wave of infections, what does this mean in terms of health and even in terms of the liberties that Kenyans have been enjoying, for example, socializing?
I think we just have to basics of prevention. And this is not rocket been asked to wear masks when we are in crowded places. We have been asked to wash our hands with soap and running water. We have been sanitized where there is no water. We have been asked to maintain social distance. All these measures like a cheese, one helps the other and helps the other. So if all of us took those measures, then we would be in a better place. We would also ask politicians to lead by example. We have seen political rallies where people are not observing health guidances. Then later on, you come to hear that there were more cases of COVID. Important for leadership to lead by example. So let's follow the basic rules. Let's remember that COVID is here, and therefore we must just do the basics.
Dr. Ari, as we almost come to a close, earlier on you'd mentioned the plight of doctors. And if you could paint a visual picture for the viewer, what is the state of doctors and the medical fraternity in general in the country in their fight against COVID-19? We've seen infections, we've even seen death. How are things looking like right now?
Health is a system, and actually all healthcare workers are at risk. And anyone working in a health facility, starting from the watchman at the gate all the way to the highest level of the doctor, are at risk. We have seen a high proportion of healthcare workers getting infected. Unfortunately, there is no clear mechanism for compensating them. We have seen, as you have said, there is industrial actions occurring. Salaries in the various counties have been delayed by several months, and therefore, how do you expect people to work? COVID allowances that should actually be made permanent have been withdrawn after a short period of 6 months, and some after 3 months actually, and some did not even get. There is fatigue, there is demoralization. A case example is one county where all the medical officer interns, their senior house registrars are now on isolation as a result of exposure to COVID. And therefore, that particular service has come to a halt. It is important that these measures be put in place so that the number of healthcare workers stop rising in terms of COVID exposure. When all of you are misbehaving, not wearing masks, not washing hands, it is the doctors and other healthcare workers who get the brunt of it and their family. So we advise you to please follow Ministry of Health guidelines.
Finally, Dr. Ari, in the spirit of Mashujaa, it goes without question that all frontline workers are heroes of this country. How can we better acknowledge the work, the risk and the effort that doctors are putting in during this time of COVID and also beyond with regards to some of the industrial actions that you've spoken about and we are seeing in the country? Very briefly.
Actually, what we need for healthcare workers is a good management of human resources for health. And therefore, we would ask our President, Uhuru Kenyatta, to establish a health service commission that will be charged with recruitment, deployment, disciplinary measures of all health workers, and all these small issues of lack of payment, lack of transferability, industrial actions, we as health workers, we think would be solved by a health service commission. So for the Mashujaas who are healthcare workers, ask the President to form a health service commission.
Dr. Simon, that's where we leave it. Thank you so much. Happy Mashujaa Day to you and all doctors and all nurses and everyone in the medical fraternity that is a frontline healthcare worker, ensuring that you keep her safe.
Thank you very much.
Thank you.